WCLN 1170 Radio and Cable Channel 16 are pleased to present We Should Know, hosted by J.W. Simmons, an upbeat, informative look at people, places, and issues facing our community. This education-based analysis of issues will remain positive and informative as we consider closely what we should know.
Welcome back, folks. We Should Know is on air. I want to thank you for being with us today. We come to you on Tuesdays at 2:30 p.m. on Star Communications, Channel 16, simulcast on WCLN Radio. Also, there's a replay at 7 p.m. Tuesday and Thursdays each week. Today, we're talking about health care, Sampson County Health Department. Kelly, you got a huge job there, a lot of responsibility, a lot of moving parts. I want to thank you for taking time to step out of that storm, so to speak, and just have a conversation with us about some things going on here in the county.
Thank you. Thank you for having me. One
of the things I want to kind of start with, and again, we're going to approach this without digging too deep into it, is this whole opioid funding, stakeholder money that as a result of a lawsuit, and I understand multiple states are receiving millions of dollars involved in this particular lawsuit. North Carolina and Sampson County is one of the municipalities that's going to receive a few $1 million in that. Kind of tell us a little bit about how that came about and what we're looking at here. Again, I realize that we don't have time to get into it too deep, but just let us know what's going on.
So it was more like a national thing where we do have an opioid crisis nationally, but that also affects us here at home, and we've noticed it even in Sampson County, looking at the data from previous years. We are seeing an increase in hospital overdose and deaths in our county. North Carolina was one of the states that joined in on the lawsuit. Sampson County did get funding. It's about $3.9 million, but it's to be paid out over like an 18-year period. So although, $3.9 million sounds like a lot of money, paying out over 18 years, it doesn't equal out to a significant amount, although a positive thing for us to have for our county to try to combat this epidemic that we have going on, our opioid crisis right now.
And one of the things, and I was, of course, along with yourself and others that was involved in the presentation, at a meeting recently in which I guess folks throughout the community came in to listen to a lot of the legal ramifications. And there were certain protocols, as I recall. It's not like somebody can call you and say, look, I'd love to have a couple $100,000 of that to do this, or this. It's got to meet certain guidelines. And I remember there was one phrase, I believe, that was used. It's called, it must fit some scientific protocols.
With the funds, we do have, there were 2 options, and under those options were, they had high impact options that we can choose from. So there are restrictions to this funding. So we cannot just spend it however we or the whole county see fit. There are restrictions to it, and we have to follow those guidelines listed in that MOA. The high impact strategies, the abatement strategies, we can choose from some of those. There are the high impact strategies, but then there were some lower impact strategies, and all that means is that there's evidence-based research that shows that your first options are more effective, whereas the other options were least effective. So being that we got the sum of money that we did, we do want to focus our attention on those high impact options. We want to make the biggest difference for our county for the money that we did receive.
When I look at those protocols and I think about what the whole idea of what opioid is doing, and one of the things I believe I've heard a number of folks talking about as a result of that meeting that we were at, the big question or the big point that they were making is, how can they be used? How can these funds, if they can, how can they be used to help in prevention? Because we've talked a lot about different things we can do when somebody overdoses and Narcan and everything else, but the prevention piece seems to be something that folks are really interested in.
Yes, and any crisis, you do want to look at prevention because that's what's going to help you in the long term. And looking at, what's going to benefit the county the most. One of those options is a prevention strategy for the youth. So it's actually going into the schools and doing programs, educating children at a young age, what opioids are and the risk of doing those types of things, the dangers associated with it and that kind of thing. If, we just feel like if there's no one teaching that, they're just learning from peers or, maybe what they're learning at home. So that is one of the strategies, and that's something that I was glad the schools were there at that meeting too, to kind of talk about how it affects, the mental health of our students, and looking at that and, and them just trying to start out in life. So I feel like we do need to focus our attention somewhat there in the prevention, trying to, capture the audience at a younger age.
Is this an opportunity for us to look closer at and better understand that relationship between the behavioral health world and the physical health world? Because we've seen substance abuse identified as a chronic debilitating brain disease, and oftentimes we kind of see both of those worlds separately, but this actually comes together with both public health and behavioral health.
Right. And I do feel like healthcare is changing and evolving into that holistic approach and looking at, the mind and body, because those things, your side effects from mental health disorders do, go into physical symptoms and chronic conditions that we see even in our county. So that is important to look at the holistic approach.
If the funds are used in a broader perspective to educate and work with children, do you see that within the middle schools, elementary, or even early high school? Is that where would those programs be offered?
I would almost say the middle school, and looking at where the issues begin. And that would be talking to our school partners too, because, finding out from their perspective what they're seeing.
Mm-hmm. Mm-hmm. In the county also, and I know these funds are for opioid, but there's a drug that comes in across the borders. There's been a lot of media reported about it. And as I recall, fentanyl is something that's being laced and kind of infused into many other rather attractive drugs. Can the opioid utilization, has it got to just be for opioids, or can it also impact those kinds of drugs that are being sold and pushed out on the street?
Yes, I think it can impact everything. And there's a new for us, it's xylazine. It's actually a tranquilizer that they use for horses or large mammals. Mm-hmm. People are actually using that, and it's causing necrosis, which is where, your skin tissue dies and people are actually losing limbs from it. And it's not an opioid, so it's not something that Narcan could reverse. So
it's important for folks to understand. I think that's an important statement, is that there are drugs out there that people are using, mm-hmm. That now Narcan has been distributed throughout the community. I think you guys have got a vending machine mm-hmm. at your place, but don't assume that because you got Narcan that somebody's in an OD situation, you go and use that and it's going to bring them back as if they were on opioids.
Exactly. And that's, we have put that on the box and made sure we have enough warnings to say, hey, if you're using this, if you use that first dose, you need to go ahead and call 911 immediately after that first dose, because, that kit only comes with 2 doses in it anyway. And they're seeing more and more, when we were talking to our partners in that meeting, it's taking more than 2 doses sometimes to bring that person back.
Really?
Mm-hmm. So it's really important that you call 911 after the first dose, even if it is opioid related. But then if it's not, we need to get help to that person as soon as we can to try to see what else is going on.
we often think that maybe we're a little bit isolated because we're in a rural area. When you look at the numbers demographically and look at the amounts, are we in the same kind of trouble as urban areas like Raleigh, Durham, places that are, heavily populated areas?
Yes, and when you look at, if you break it down by population numbers, it's affecting us in the same way. I think in 2019, I think there were 7 deaths, and then in 2021 for our county, there was 17, which is a huge jump. Almost double. Mm-hmm.
Do you anticipate, and again, we've talked about education and so forth, but is there some way, it just seems logically, and folks listening and watching the show today might say, well, if you're telling somebody something that's going to kill them, that's about all you can do. But there's other things I know that you've been involved in and the health department's looking at doing.
Yeah, so along with the opioid settlement funds, we are actively applying for grants to try to get more money into this crisis. We do have the kiosk, which is available 24/7 to someone. It will dispense a Narcan kit immediately. One of the first questions on there is, is someone having an overdose emergency right now with you? Because we were just thinking if somebody pulls up to that machine, they've got somebody in the car with them that has, passed out, overdosed. That machine will automatically dispense that kit. If not, it'll go through some questions so that we can collect data from the person. But we've actually dispensed almost 50 kits from that machine since August.
Wow. Let's pick up on that when we come back from this break, because I want to talk about Narcan and a little bit about the location of those machines. Ladies and gentlemen, we'll be back in a moment. We're talking about a life and death situation here. We're talking about stuff with public health, and Kelly Parrish will stay with us, and we'll be back in a moment.
105.7. 105.7. Tuning into Christian 105.7 is tuning in to a space of hope, encouragement, answers, and love. With the magic of radio or the convenience of the internet, Christian 105.7 is focused on sharing the universal truth and light of Christ with a local touch that creates that special feeling of community. More than just another broadcast station, we're your neighbors. Christian 105.7. What faith sounds like.
If you run a business, you need sales. To get sales, you need customers. To get customers, you need exposure. Let our team of experts craft and produce the perfect video ad to reach your intended audience while making the most of your advertising dollars. Call 1-800-706-6538 or visit starcom.net to contact our Star Communications production team and get your business moving to the next level.
Eastern North Carolina is a beautiful place where we gladly choose to call home, and we strive to provide the best communications services. STAR is committed to improving communications to all our service areas because we want to improve the communities where we not only work, but also live. STAR Communications. We are neighbors serving neighbors.
Ladies and gentlemen, welcome back. We Should Know's on there. I want to thank you for being with us today. We're coming to you, Star Communications Channel 16, also WCLN Radio simulcast. We're talking about health issues. We're talking with Kelly Parrish, who's the Director of Nursing at the Public Health Department, Sampson County Public Health. Kelly, your department, the thing that you do here with Sampson County is replicated throughout the state. I mean, just about every county, my understanding is, has a public health department.
Yes, sir.
So this is often a door that many people either go through, or many times when they have a health crisis, most folks think, well, they end up at the ER, and I guess possibly they do, but they also end up in your area because you're head of nursing. We talked a bit about the Narcan machines. That's medicine that is supposed to bring people back after overdosing on opioids. I have been asked, should those machines, should that be accessible in multiple locations rather than just a few around Clinton? And even the discussion I've heard from folks and people sometimes just stop me and say, well, why don't they do this? Why don't they do that? And one of those things is, and you can answer this, I guess, why don't we have multiple machines maybe at the rural fire departments or at churches or at other locations? Is that just something not practical, or is the financial part not there?
So it does have a lot to do with cost. It does, we pay per month for that machine, the one we have at the health department now. That's why we applied for the grant that we did, that we are hoping that we can get that, and then we can add another machine in the county. You know, Sampson County is so large and vast, and if you think about, you know, people like the southern part of the county and that kind of thing, we'd love to have one down there. Another issue we've run into just with it at the health department is, you know, the internet connectivity, because it does run off of just a cell phone device that is in the machine. Okay. So we do have network issues there. And we were trying to kind of get the kinks worked out before we added another machine. But there are machines that are just like a dispensing machine. They're not really, they don't have the ability, to collect data and things like that, but it will just dispense a kit. And we're hoping that maybe one of those may work better in a more remote area.
It's interesting you mention that, because I'm not sure, I know I don't really know how they operate, but kind of explain, if you will. I'm going down the road with a friend or somebody and discover that they've overdosed, and I know there's a machine somewhere. I guess you can go online and pull them up. When I get there, walk us through what the process is. I mean, do you have to fill out a form? Do you have to log in? What do you have to do to get to the medication?
So there is a QR code, and we do have that on our website and Facebook page. So you can actually use the QR code and pre-register and, you know, do all that beforehand. But essentially, if somebody's coming for an emergency Narcan kit, there's no real pre-planning with that. So they just go up to the machine, and it just asks them, you know, what they would like to be dispensed. And we do have COVID tests in there. So they can choose the Narcan selection, and that's whenever it'll, you know, the next question after that is, you know, is there someone having an emergency right in front of you? If they hit yes, the machine dispenses that kit, no questions asked.
So you don't have to go through a form or tell them who you are and give them a phone number and an address and all that?
No, only if you answer no to that question, it will take you through that data. But if you don't choose to answer it, it doesn't stop you from getting the kit just because you don't answer those questions. I do think there was a little bit of a stigma with that, with people having to provide that kind of information. Before we had the kiosk, and, you know, with the laws, with the pharmacy laws before, patients had to call the health department and make an appointment to come in and get the kit.
Really?
So last year, we really didn't dispense hardly any Narcan kits. And when you look at the crisis, and you're like, well, you know, that's not really the best.
It's not practical.
Right. So then whenever you eliminate that, someone having to come in, get an appointment, collect information, the fact that we've been able to dispense 50 since August is phenomenal to me.
It is.
We've done a lot of advertisements as well. Right. And it's more of a, more of a privacy thing. They're able to just go up there at their own convenience. It may be where they're working 8 to 5 and they're not able to come into the office like that. So I do love that machine is available 24/7 to anyone. So,
do you think it is practical to look at that idea of more machines within rural county, particularly located, as you mentioned, maybe in the Harrells, Ivanhoe area, and then maybe 2 or 3 in the northern part of the county, and kind of have it highly advertised where they're located? And the conversation I had with some folks was, well, the fire departments are perfect locations because they're facilities that folks are familiar with. A lot of them are on main roads and so forth. I'm just wondering if that is a part of the conversation you and the management team are looking at.
Exactly. We are wanting to do more of those locations like that. And with the connectivity issues, we would probably just do the dispense machine, not necessarily the one that collects all the data. But that is what we're looking at, to have more access like that.
Is that a reasonable expenditure of these kinds of funds? Does that meet the protocols that's set out in the MOA to use funds for that purpose?
Yes, Narcan is listed as one of the high impact strategies. So that is one that we could look at, that we are already doing essentially. We could just, boost that. And also it's just important to know that although those machines are there when you're in an emergency, if you have a family member that may be prone to substance use, that you could get those kits in advance. And you can even come to the health department and we can give you more than one kit. It's nice for everyone to have a kit like in their car. You never know when you're going to come up on someone that, passes out.
That's right. It could be somebody you don't know.
Right. So you can always get it, in advance, not necessarily during the emergency.
How do you make that determination if it is opioid and if that person may have the chance of survival if you use Narcan? How do you know that? And you made that point, I think, that you might come up on somebody. It might be whatever situation you're in, and somebody's laying there and you're thinking, oh my God, how do you know? Do you just use it anyway to see if they come back? Or?
Yes, and especially since we're in this crisis now, that would be something you would do. If you gave it to someone inadvertently and they're not overdosing, it does not hurt them.
Oh, okay. So you're not going to do any more damage than what's already done. And
it's going to work if that is the issue. It'll bring them back. But if it's not and it doesn't work, there's something else going on, and then we would just recommend CPR.
To establish the machines in multiple locations, is there a standardized cost that you guys have either put together or could put together to say we want to use $200,000, $300,000, whatever amount of dollars just on machines because they are kind of a high tier prevention, a life-saving thing? Have you looked at that budget to say this is how much we want to spend on it?
Yes, and internally we've looked at that at the health department. So that's why we have the one machine right now. And then with the grant funding we're hoping to get, we can add that additional machine. As far as the opioid settlement funds, that would be something that's in the discussions with the collaborative group to see if that's something we want to do. Because I know we've discussed it with the hospital, and I think they were interested in a machine as well. Just looking at putting them, in different parts of the county.
I think you hit a point that I want to kind of follow that thread a little bit that's important too, is that oftentimes folks may have a sense of shame or fear. They want to remain anonymous. It's like sometimes people call in 911, they'll call 911, but then when the dispatcher tries to get into information like, are you there now? What's your name? They don't want to talk about that. They just want to say, well, just send somebody. Is that kind of the same thing with this type of operation?
Yes, sir. And that's what I contributed to, as far as, going from not dispensing any hardly to 50 just with a machine that, somebody doesn't really have to interact with or put any kind of information in.
How easy are these things to use? How easy is the Narcan to use? Is it just a matter, is it like a spray bottle? Is it the directions on it? Or?
There's a small nasal spray. And you just push it down just like you would any other nasal spray.
In both nostrils?
And there's a quick start guide on the box itself. So the box actually folds out whenever you open it. There's a tab on the front and it lays it out. It's got pictures. It's in very simple instructions. It tells you exactly what to do.
So just listening to you, this is almost like one of those automated defibrillator things that actually can shock somebody back to life. It's just that critical because they're technically gone unless something is done.
Right. And it's life-saving in that moment.
and I've talked to a number of the emergency responders, paramedics and stuff, in their conversations they've actually seen and been involved in where folks maybe have children and they're literally in the car at stations and different places, and all of a sudden, they're gone and the child's in the back seat.
Mm-hmm.
I mean, this is horrible stuff. I guess I'm trying to bring that up because I want folks to understand what we're talking about is not only life-threatening and deadly, but it destroys family units, it destroys communities and that kind of thing. So when we come back, I'm going to kind of wrap this up and get into some other stuff that you guys are doing. But this is just so important that we look at things that you talked about, xylazine, and we look at things that are literally killing people, and we have no idea of that. So we'll kind of wrap that up and move to something else. Ladies and gentlemen, stay tuned. We'll be back in a moment. We're talking about crisis situation and where you can get help. Stay tuned.
Providing fewer commutes, more backyard offices, and crystal clear meetings. Providing less, you froze up, and more presence in your presentations. Providing a better internet experience. Providing possible.
You're out for an evening on the town. Finally a chance to relax and forget that you left your front door completely unlocked. Fortunately, you just installed a security system from Star Communications. With just your cell phone, you can check on your house, lock it down, light it up, and get back to relaxing.
You forgot to put Buster in his crate.
Unfortunately, we can't help with that. Security and automation from Star Communications. Call today to find out more.
Most aging adults want to stay in their homes as long as possible. And as your loved ones get older, you want to support them, even when you can't be there. Star is proud to offer Star Alert. This new system is now mobile and has GPS compatibility, so your loved ones can live their lives and you can have peace of mind, knowing they can get the help they need with just the simple push of a button. The new Star Alert also offers automatic fall detection, so help will be alerted even if they can't press the button. Call and ask about Star Alert today.
Welcome back, ladies and gentlemen. Thank you for being with us today. My name is J.W. Simmons. The name of the show is We Should Know. And again, we're talking with the Public Health Department folk here, and her name is Kelly Parrish. Kelly, Director of Nursing at the Health Department in Clinton, Sampson County. You see a lot of stuff, and we've been talking about substance abuse and issues of that nature. As we discuss that in some of these kind of nuances of animal tranquilizers and these kinds of things, it does segue into behavioral health. Do you connect with East Point or other organizations that East Point funds to be able to help you through the process of behavioral health, or do you have counselors on site? How does that work?
So we do have public health nurses that are trained to do those kinds of counselings. We have screening tools that we use, but if the patient is in need or based on the criteria that we're using, we do call East Point, and they talk to the patient directly. They'll actually, come out on site to them if they're in a crisis. They have a mobile unit. And they also have the Carter Clinic is something newer, but it's and they brought it out to us and we looked at it, but it's like an RV that they actually have treatment, all things in there for behavioral health and mental health. They do treatment, and there's providers on there as well, and they'll actually go to the patient's homes, which is nice because sometimes in the demographics we see, they may have like access to care issues. So they may have lack of transportation or those kinds of things. So it's nice that that's like a mobile clinic.
Wow. That's amazing. I think more people that know that should be able to feel more comfortable in calling. Is the number that you have at the health department, when you call that number, if it's after hours, should they call that number? Should they call, I guess if it's a emergency situation, 911 is what you call it. I get that, but if it's for somebody just saying, well, look, I know somebody is, I'm aware of somebody in the community, or maybe a church person or whatever that calls and says, we have somebody that I'm concerned about, do they just go through the emergency services department and not you guys, or how does that work?
So when you call the health department after hours, it will link them to the emergency services, and they have a call down tree for us. So they call us if there's an emergency like that.
So you and your staff are available 24/7. And do you have people on call over the weekends and late at night? I mean, do they have like a special be alert because you may be called out?
Not necessarily. I know, like we just know that if there's a situation that we may be called out, like for tuberculosis, for example. Yeah. We were just doing some of that work on a weekend, on a Saturday, just because it has to be done, and sometimes you have to kind of you have to do it when it's convenient for those people working.
So basically, a lot of this is that is sometimes exploratory for you as well, because you may run on something you hadn't faced before.
Yes.
I want to kind of segue a little bit. You guys put out a nice document. This is online, so if folks want to look at it, it's called the Sampson County Health Department Strategic Plan 2022 to 2026. That seems like far away, but it's really not. And this was adopted in February of this year. But it really brings the attention of the vision of the health department, and it talks about the vision of Sampson County Health Department, and is to provide services, prevent adverse outcomes, promote efforts to improve the quality of life for residents of Sampson County. When I read that, do you feel comfortable with the funding access, with the capacity and capability that you have as director of nursing to be able to fully fulfill that? Or is that vision something that you're hoping that you can continue to pull things together to accomplish that?
So we do have to pull together different, and we are consistently applying for grants to try to meet those demands and get that extra funding. We feel like public health really on a federal level is chronically underfunded usually, and I feel like what happens is we really create this almost a weak infrastructure with public health on a federal level, looking at the United States, because what happens is whenever we go into like a pandemic like we were just in, and we get funneled billions of dollars, but then we have to use that money within a certain time frame, and then there's restrictions on how we can use that funding. And then the funding has to be spent by a certain time, and then it's like we get that funding, we have to spend it for certain things, and then it's in a couple of years whenever that funding's gone, and then we have another pandemic that happens, and we're back to low funding. And I think that's like the cycle that we get into sometimes with public health, that we wish we were funded like that at all times, so that way we could probably better prepare. But we do try to prepare for things like this, and looking at COVID and just like a continuous response of being on alert for things, new things that come on the horizon that we have to resolve.
One of the things that strikes me is our last conversation, I think, was during the COVID process, and we're hopefully clear that cycle of it. I mean, we're not being required to wear masks and that kind of thing. If you had to pick out 2 or 3 things that the health department learned from the COVID experience, what would you say that would be?
Definitely the importance of information dissemination, making sure that the information is consistent, and that you're putting, prefaces to the data that you're putting out. I think there was a lot of you know, your data's saying this many cases, but the state's saying this many cases and the CDC saying this many cases, and it's dependent on, you know, what they're actually looking at as far as what is a case. So I think that was a big rule that a big lesson learned there. I think we learned the value of strong community partnerships. And I think those partnerships grew stronger through the pandemic. Just, you know, being able to have those partners and just looking at all the resources that even I didn't even know was available in the county. It kind of really helped me see that and how great we really are, you know, even to be rural.
Do you feel like we've got the collaboration we need in the county in case we have another event of that nature?
I do, just because of how swiftly we were able to put together those vaccine clinics. Just, you know, with the community partners we had, everybody jumped on board. You know, there wasn't, you know, that's not my role kind of thing. So that was a big help for us, and it went really smoothly.
Kelly, when I look at this vision statement, long-range planning, as you look down the road at other events, what are you seeing that you guys are saying, well, we might need to prepare for this? I know we have hurricanes here all the time, but is there something else that health-wise that you're kind of keeping your eye on, so to speak?
Not necessarily specifically, just knowing that those respiratory illnesses are probably going to come every couple of years. Pertussis is one that it seems like every 4 or 5 years we'll have a little burst of that in the county. So we just kind of keep on our toes that, you know, something may be happening soon.
This whole not only opioid thing, but dealing with COVID, I think just has focused more on public health. I mean, DHS, as you said, was putting out a lot of information, but a lot of people depend on their local health departments to be the personal kind of treatment place to make sure everybody is treated fairly. And we like to say in public health, how we're different is public health's looking at the whole community versus, you know, if you're, you know, working as a bedside nurse in a facility, you know, you're taking care of that one patient that's in their acute illness that they may be having at that time. But public health actually, you know, we're treating that one TB patient for tuberculosis, but we're actually protecting the whole community by treating that one person. So the contagious diseases, whether they're airborne or whatever, is one of your top concerns going forward. And diseases oftentimes that, and I think we saw this in COVID, that confront our adolescent population, our children in schools and so forth, is the biggest contributor to communicating that disease to somebody else. So how do we even think about, I mean, a lot of folks will say, I just don't want to go through a COVID thing again. Is there a possibility we could end up in that same situation with masks, isolating at home, staying in one room and all that kind of thing? How practical, how realistic is that? I mean, I guess somebody would have to be honest and say, well, I'm certain anything can happen, but I don't want to put you on the spot with that. But that's something that's oftentimes going through folks' mind. And you can't just isolate forever in a bubble.
Right. And I think, you know, years ago with the H1N1, you know, I think that was the last, you know, and I remember Wanda saying, you know, I went through that, but, you know, it doesn't have anything on COVID. So I guess we don't know the severity of each one, but it seems like every few years we do get something.
I want to, this next segment coming up, I want to kind of touch on, and I know you guys do a lot for what is determined as underserved populations and those kinds of things, but I want to touch on that a bit and just make folks aware of, I guess, of things that are available, readily available through the health department, and also to encourage people not to hesitate if they need to engage the health department, that it's not something elusive. It's there for a purpose. It fits your mission, your vision statement here, and certainly your vision statement. So if we can, let's touch on that, and then I think we'll be kind of where we can wrap. Ladies and gentlemen, stay tuned. We're back in a moment. We're talking with Kelly Parrish. We're talking about public health. It's situations that may affect your life. We'll be back in a moment.
Just because something may work doesn't mean it's right for your business. Let Star Communications' knowledgeable consultants help you customize a hosted voice system that's right for you. Our dedicated experts work with you to understand your business needs and guide you at every step, from choosing and installing services to ongoing maintenance and support. Contact Star today.
For the ultimate Wi-Fi experience, you need whole home Wi-Fi from Star Communications. Star's whole home Wi-Fi provides ultimate coverage, ultimate performance, and ultimate power all the time. Star's whole home Wi-Fi systems feature the latest Wi-Fi 6 technology and are equipped with unrivaled bandwidth and 4 times more simultaneous connections. So you can connect tons of devices throughout your home with no lag and no downtime. Plus, with 24/7 support and remote troubleshooting, you can rest assured that Star is always there to help you should any issues arise. Star's whole home Wi-Fi also comes with the Command IQ mobile app, putting you in control of your home network and making it easy to set up and connect devices, run network speed tests, pause Wi-Fi, and set parental controls all from the palm of your hand. It's the ultimate Wi-Fi experience. Contact Star today to get started.
Ladies and gentlemen, welcome back. Thanks for being with us. We Should Know, coming up on the last segment of the day. My name is J.W. Simmons. I'm your host. Each and every week I come to you at Tuesday at 2:30, and also on Star Communication Channel 16, simulcast on WCLN Radio. Want to remind you every week, different show, different content. We're fortunate sometimes to actually have folks come back and kind of refresh us. We're doing that today with public health. We got Kelly Parrish with us. Kelly, again, thank you. It's been some time since we talked. It's been a very learning experience to have you back today to talk about a lot of the opioid stuff and particularly substance abuse issues. And it's tragic that you've seen that. Your department ends up sometimes in a screening process and trying to get folks help with public health. All of those things you have in place. I want to talk to you about kind of what is often referred to maybe as populations that's underserved. And I know in the past, I believe maybe we've discussed some of this, but we have a large influx of workers in the county that are coming in from South America, Mexico, and other places. They're H-2A workers. We probably have a lot of people here that we don't know is here simply because of the hundreds of thousands of people who come across the border. How do you reach that population? I know when I call the health department number, I get multiple messages, both English and Spanish, which is great. Do you see those people either coming to you, or do you have a program where you go out to those people? Because we're literally talking hundreds, if not thousands, just in this one county.
Mm-hmm. So I think we do a good variety of both. We do see a lot of them in our clinics. We're also seeing increase of the Haitian Creole population. So that's up and coming as far as something different that we haven't seen in the past.
Is that a language situation shift, or is it all under the Hispanic Spanish language area? I think they're coming from Haiti. So there is a different communication. How does that impact what you do? So it does affect as far as, because we do have in-person Spanish interpreters, but we do not have in-person, people that speak Haitian Creole. So we do have what's called a language line, which is we used to just use a telephone, and then they will connect us to the language that we needed.
But now we have it actually on like an iPad, so we can actually see the interpreter on the screen, so it makes it a little more personable for those patients. But we just want to make sure that the education and stuff gets clearly to them through that interpreter, having that different language.
Do you have people that actually go out into the community and in the areas where these folks live and that kind of thing? I know the Ag Extension, we interviewed some folks here with Ag Extension that just kind of stays in contact with that group of people and interacts. I'm just wondering if the health department has a similar program, or do you maybe you interact with the Corporate Extension people?
We do outreach for certain things, like for the COVID vaccine. Hate to keep bringing that back up, but that was something that we went out and did those vaccines to those communities, you know, late at night whenever they were, you know, finished working, those kinds of things. And we do a lot of the outreach also with tuberculosis with that group. And we do contact they help me out a lot at the Department of Ag there, just because they have all those contacts that we may need to get up with a certain farm or that kind of thing.
Do you find that the folks in that population are receptive and understand what you're doing, and are they willing to be, like with COVID, inoculated and that kind of thing, or is there some hesitation?
I think there's way more, I think there's less hesitation. They're more receptive to our care. I think sometimes we have to get them to buy in sometimes by, you know, using like a trusted leader in that community. I think we learned that with COVID as well, that sometimes you have to get someone that they trust, you know, to speak, more so not somebody from a local government agency. You know, there may be some distrust there with that.
Well, and the reality is, you know, a lot of folks may say, well, looks like these folks would have to pay and all that kind of thing, but they have no resources to pay with, or they don't have any way to even think about insurance. But yet at the same time, they're doing vital jobs that without them, I've been told by some of the farmers, they just literally, they wouldn't be able to function. So it's a vital job. And at the same time, it just seems to, we all need to understand that we have to do and make sure that these people are looked after, because you just can't, you can't leave people laying beside the road with a broke leg or something. You know, you got to do something. Right.
And something that's, you know, infectious is going to affect you and your family. Yeah. If they're not taken care of. So,
is the health department looking financially down the road? Are we in a position, and I say I'm looking at the total budget for the county, is there funds accessible, or do we have to be more creative in obtaining funds to ensure that we're able to look after these, what appears to be an expanding population of folks?
We are looking at that, and that's another reason for the grants that we apply for. We're actually doing one right now for access to long-term contraceptives, because they are so expensive for us to purchase as the health department. And then when you have patients that come in that, you know, don't have the access or means to pay for those devices, so we have to have that extra funding to help that, which in turn helps as far as, you know, looking at infant mortality rates and things like that, keeping that low for the county, you know, keeping healthy moms, healthy babies, those kinds of things.
We oftentimes see, particularly farm workers, we see them in the fields and on buses and those kinds of things. Is there also a family, is there a number of family units to include children and so forth that travel with these groups, or is it the majority of it just single individuals?
As far as I'm aware of, it's mostly single individuals. I know that there is rural health population group, Office of Rural Health, that go out there and actually they do like their health assessments and those kinds of things. And whenever they need something from the health department, we do that. But they get looked after that way.
And I want to just take this to another level. I've got a lot of stuff here I'd like to talk about. I know I'm not going to be able to get it in, but when we look at funding, oftentimes public funds are not there. Do you have, or have you thought about this idea of reaching out to faith-based communities and saying, look, we need your support with whatever it may be to make sure that we can go out and, even if it's inoculations, that we have the access to that we have people that can do that. And the reason I'm asking that question, quite often, churches and other places will work hard to, and it's a wonderful thing they do for outreach, like in other countries and so forth. But my concern is I just want to make sure folks are not missing something right here on our doorsteps that really need funding, and we're trying to ship stuff here and there. I mean, I just think sometimes we overlook people that's standing in front of us, is what I'm saying.
Mm-hmm. Yeah, I agree. So we do have, we had a committee that is working on, it's advancing equity. So it, is helping those that are, less fortunate, maybe have access to care issues and those kinds of things. And we do have faith-based organization team members on that team. So, and they do help. They're a vital resource for this community because they have a lot of resources that they're able to provide that you normally probably wouldn't think of.
Last point. What's the biggest challenge you see for public health and what you do as Director of Nursing in the coming year?
So right now we're probably looking at a nursing shortage and probably a healthcare worker shortage across the board, really. But speaking more toward the nursing shortage, I think in 2021 they've actually called it the Great Resignation of nurses.
Wow.
I think like 30% of the total U.S. population of nurses quit their job.
Well, and we've already seen healthcare workers in certain areas of the country going on strike, just simply saying we're not going to do that anymore.
Mm-hmm.
Shouldn't that really shock everybody? Because we're talking about folks that are basically the fabric that in case we have an emergency. I even think about, let's hope that don't move to dialing 911, you don't get a answer. This is really critical stuff.
Mm-hmm. And I think like looking at the pandemic and those side effects after that, aftermath, because even though we feel like, as just, community members that we, heard so much about COVID and it was everywhere, but those healthcare workers that were actually at those bedsides that, were talking to, these people with COVID, they, lived, ate and breathed COVID for years.
Yeah.
And I think like a little over 50% of healthcare workers are experiencing some kind of, PTSD symptom from the pandemic.
It's almost like they've been on a battlefield, except this is a human emotional field, I guess you could say they've been on. Last word, and I'll give it to you.
Well, I appreciate you having me. And I am excited, and I meant to mention this earlier whenever we were talking about the opioid stuff, but there's that changing pathways.
Yes.
Changing paths, I think, I'm sorry.
Yeah. Changing paths.
Is the new rehab facility that's coming over there on Martha Lane. So that is an awesome resource for our county, and we're really excited about that.
Well, thank you for mentioning that. We've had Susie Teague on and we've talked to her about it, and it is a wonderful multi-million-dollar operation. So thank you for being with us today. Ladies and gentlemen, we look forward to seeing you again next week right here for We Should Know. And as always, may God bless.
Thank you for tuning in to this week's episode of We Should Know with host J.W. Simmons. If you have a question, comment, or suggestion regarding this or any episode, please send your emails to weshouldknowedu@gmail.com. And remember to tune in every Tuesday at 2:30 for another informative episode of We Should Know.